Okay, great. Thanks everyone for joining our weekly COVID-19 press call. Today, we're being joined by Dr. Idzerda from Billings Clinic. We're also joined by Tracy Ellig from Montana State University, Kallie Kujawa from Bozeman Health, as well as Dr. Darden from Bozeman Health as well. So without further ado, I'm going to go ahead and get started with our weekly surveillance reports. Okay, let's start from the top. So, okay. So our first figure here describes, again, the number of daily cases on a 7-day rolling average per 100,000 individuals. And their 7-day rolling day average for cases per 100,000 residents was 50.8 per 100,000 as of 11/3. This was a 20% decrease from the last reporting period. And I would note that this is a 20%. We've seen this decrease over the last 2 reporting weeks. So we're continuing to watch this trend. We're hopeful again that it will continue to trend down or plateau, but we don't know yet. So we're just going to keep watching that as we move forward into next week as well. Figure 2 is our percent positivity. And for our 7-day rolling day average of percent positive, we were at 11.9% on 11/2. This was a 14% decrease from the positivity rate that we published as of that ended on 10/26. So again, we're seeing a decrease in our percent positivity. We are still above the 10% threshold here that we see on this red line. Median time from specimen collection to reporting to public health is 1 day. This is a good trend that we want to continue to see. And in terms of cases by vaccination status, again, the orange bar here is representing the cases of those who are not considered vaccinated, fully vaccinated. The blue bar here indicates cases amongst those who are what we would consider breakthrough cases. And again, that trend has stayed pretty similarly, with number of cases among the unvaccinated being more than those amongst those who are fully vaccinated. Same with our hospitalization rates. Again, the orange bar indicates those individuals who are not vaccinated or considered fully vaccinated, and the blue bar indicates individuals who are considered breakthrough cases and hospitalized. Moving into the percent of Gallatin County residents who have received their first dose. And again, we indicate a 1% increase in bold in these different age ranges. And we have seen a 1% increase in most of the age ranges, which is a good sign. We want to continue to see individuals seeking our first dose. And so we are seeing at least a 1% increase in most of these age ranges. And similarly, we also saw a 1% increase in being fully vaccinated in most of our age ranges as well. And as a reminder, we have 63% of Gallatin County residents who are, as of last reporting period, who are eligible for a vaccine, who are considered fully immunized. And we're sitting right around 4th in terms of, as you look at the entire state as a whole. So our vaccination rates, we continue to see more and more individuals vaccinated, and we want to continue to see that trend. And with that, I'm going to go ahead and stop share and send this over to Kallie to speak to Bozeman Health updates, as well as the vaccination clinics.
Excellent. Thank you so much, Lori. I always love seeing your stats, but it was especially refreshing today. So thank you for sharing all of that. And for those of you I don't know, I'm Kallie Kujawa. I'm Bozeman Health System Director of Quality and Safety, and I'm our Incident Command Lead as well. Thanks again for joining. We currently have 20 COVID-19 positive hospitalized patients at Deaconess Hospital. We do not have any COVID positive patients hospitalized at Big Sky Medical Center. Our critical care unit at Deaconess Hospital has 20 beds and is currently at 90% capacity, something we've seen maintained and pretty consistent over the last couple of months or few months. 10 of the 18 patients, so over half of the patients in our critical care unit are COVID-19 positive, with the remainder being all other healthcare needs. Additionally, our medical unit is at 97% capacity, and our surgical unit is at 118% capacity. Keeping in mind that on our surgical unit, we do have medical overflow patients. As you know, Bozeman Health is partnering with Gallatin City County Health Department and has been proud to have been doing that for so long now, to hold COVID-19 vaccine clinics at Deaconess Hospital at our entrance 1. To date, we have administered, I'll say it slowly because this is very exciting. We have administered 6,856 booster doses for Gallatin County residents. And we have administered 5,328 total doses. We're just so proud of those numbers and very grateful for our community for showing up to get vaccinated. We started administering pediatric Pfizer vaccine yesterday, and I'm absolutely beaming with excitement and I'm so honored to be providing this to some of our littlest patients now. Yesterday, we gave 301 vaccines to pediatric patients who are 5 to 11 years old. So a very exciting day for many families yesterday and today and the many days to come. I do have Dr. Chris Darden, Bozeman Health Pediatrician, who's here with us today, and he'll be answering any questions on pediatric vaccines when we get to the Q&A session. But I'm going to switch gears just a little bit and talk about what also happened yesterday, which was the Centers for Medicare and Medicaid Services released their regulations on COVID-19 vaccination for healthcare workers. As you can imagine, our legal, our compliance, and our human resource teams are actively working to review the issued regulations. And we have participated in a CMS-hosted Zoom call yesterday as well. There is so much to be reviewed and considered as it relates to the federal mandate and Montana's House Bill 702. We do understand this is a topic of very high interest and appreciate all of your understanding of the time we require to carefully and thoroughly review to generate the best and most accurate information to our care teams as to how this affects them and Bozeman Health as a health system. We anticipate sharing next steps in the coming weeks. The health and safety of our employees and our patients remains our #1 priority. Vaccination is an important and proven method to help keep everyone healthy and safe from COVID-19, to prevent spread and avoid the return to more stringent public health measures, and really ultimately supports extinguishing the pandemic. So continued encouragement for those that have not yet been vaccinated is an effort driven by our safety focus and our mission. And we'll continue to update you as we know more on the translation and how that will affect our healthcare workers. So thanks again for joining, and I'll turn it over to you, Lori, for our next speaker. Thank you.
Great, thank you, Kallie, for that update. Tracy, do you have update from MSU?
I don't. I think we can move right to questions. Thank you.
Okay, so as I mentioned at the start, we have Dr. Idzerda and we also have Dr. Darden, both are pediatricians and very much interested in answering any questions that all of you have as it relates to questions that you may be hearing from the community. And this is just a really great space to bring forward some of those questions and have them answered by our messengers here. So I'll open it up to any questions from all of you?
That means everyone's going to get their vaccine, right? No questions?
Hey everyone, this is Juliana from the Chronicle. I guess I'm wondering, as pediatricians, what you've been hearing from parents, if you've been hearing any specific concerns or questions from them about the pediatric vaccine.
I mean, I think some of the initial questions I'm answering from families are about would I do it in my own kids, which I certainly would if they were eligible and in the age group. Getting questions about the safety profiles, about myocarditis, about all sorts of different, questions that are kind of out there in the mainstream media, and just kind of reiterating that it's a pretty darn safe vaccine, and COVID, well, generally is not landing kids into the hospital. It certainly can, and we certainly do have a lot of medically complex patients in the Valley, which I'm sure Dr. Idzerda can speak to as well, that have been getting COVID. And the best way to protect these patients is by vaccinating their older siblings if we're able to, and vaccinating all of our school age kids now that we're able to.
And I would reiterate that I'm getting a lot of questions about who should be vaccinated, how serious is this illness in children? And what I tell families is that while the initial cases in childhood were really quite mild, sometimes only some nasal congestion, we're now actually seeing kids with this Delta variant who are sick, who have fever, who have cough. And while we haven't had many need to be hospitalized or be seriously ill, there are a few. Certainly our most vulnerable children need to be vaccinated. And many children in families where there's somebody else who's immunocompromised or a grandparent that they see regularly, they really need to be vaccinated to help reduce the chance of carrying something to a family member. This is recommended for all children 5 and up now, and I encourage families to consider this seriously, but especially these high-risk families. That I think is another group that really just needs to go ahead and proceed with the vaccine.
This is Holly Michaels with Lee Newspapers. I had 2 questions that people had emailed into me asking about COVID vaccines for kids. The first one was wondering, kind of between like the 11 and 12-year-old, people were saying like, I've got an 11-year-old that looks more like a 13 or 14-year-old, like they're pretty big kids. So would a smaller dose be right for them? Kind of wondering how that works. And then the second one was if you had a child that had COVID, you kind of read up before this time, like how long generally would a kid have to wait from their infection and recovery before getting vaccinated?
These are 2 great questions.
So yeah, those are awesome questions. Maybe Dr. Idzerda and I can both answer them because I don't know if there is a straightforward answer. You can answer first if you can.
Oh, okay, certainly. So the cutoff and the recommendation is based on age. So under the age of 12, children should get the child vaccine, which is a lower dose. Over the age of 12, they get the adult vaccine. And while some of our 11-year-olds look like young adults, they still get the lower dose vaccine. Some families have asked me, should they wait until they're 11 and 11 month and a half child is 12 to get the vaccine? And I say, I think that's reasonable. But if they're just, it's going to be 4 or 5 months before they're eligible for the larger dose, I tell them to go ahead and get it. I think the second question about boosters is if a child has had the illness, I usually recommend they wait 2 months and then get the vaccine after that time.
Yeah, I don't know if I would have a firm time period after an illness, just because we do know there's other variants that are kind of emerging and things. And even with other vaccines such as influenza, if we are to get a vaccine on board, it can help with other variants as they kind of emerge. So I don't know if it's totally set in stone on when we need to wait after an illness, but I don't know if I would have like a firm cutoff of like, oh, you just had it 2 weeks ago, we can't do it today. In my mind, that's also a visit that they have to come back for. So I would also like to kind of get vaccines as we're able to in clinic. So I would be of the mindset of doing it as soon as we're kind of feeling a little bit better from the illness.
Awesome. Thank you, guys.
I guess I had another quick question that I've been kind of hearing. Since I guess I'm wondering if younger children, if we know that they can get that long COVID syndrome, and if that's a factor to kind of, when you're talking about vaccines, if that's something you tell parents.
Chris, I'll let you go first on this
Yeah.
one.
So I think at a recent conference that I went to, put on by Children's LA, one of the speakers was an infectious disease specialist, and there's definitely some emerging data just with kind of the explosion in cases in kids recently, that certainly, as with anybody, we could all be set up potentially for long COVID. I don't think that there's a lot of like paper-based studies or anything out there right now, but certainly that's kind of an evolving data set, as unfortunately a lot more kids got sick this summer and this fall for sure. So it's going to be one of those things that sometimes we just need more time and more numbers to kind of evaluate. So in my opinion, I feel like we would, kids would be potentially set up for quote unquote long COVID. And, if that's a reason that a family would want to vaccinate, I think I'm all for it. And I think, time will kind of tell the long-term ramifications of a COVID illness.
I completely agree. We really just don't know. But I'd say that we've seen a couple of things that are happening. First of all, we've had several kids who've had very prolonged febrile illnesses, 2 to 3 weeks of fever, getting full evaluations for other possible causes of these prolonged fevers. And it is COVID. So while that doesn't meet this official long COVID and this consequences of COVID that we talk about in adults, it certainly is not a minor illness if you have 102 fever for 2.5 weeks. And then you're slow to recover, of course, from that because you've been sick for quite a while. The second thing that we've been seeing, unfortunately, is the cardiac side effects of COVID infection. So there's been a lot of talk about the cardiac effects of the vaccine, but from COVID, we're seeing that in a much stronger and robust way. And so we'll have kids coming in with episodes of tachycardia lasting literally months after COVID infection. So again, I think that kind of doesn't fit into what we think of as long COVID in adults, but it's certainly a concerning sign in children.
Awesome, thank you, that makes sense. And then I'm kind of wondering what we know about, I guess, transmission with COVID in younger children and the vaccine. Yesterday I was talking to some kids who were very excited they didn't have to wear their mask or as much, and I realized I didn't really know much about how getting younger children vaccinated is going to affect whether or not they can transmit the virus, if they should be wearing masks and quarantining and all of that fun stuff.
So the AAP, which is our mothership, the American Academy of Pediatrics, they have a interim guidance that's updated every single month with school guidance for COVID. And even with the release of the vaccine, they're still recommending full masking. The reason is there's multiple reasons. One is the vaccine uptake in local communities. We saw the data here, it's like 40% in those eligible adolescents. So certainly we're not gonna have full uptake, unfortunately, of the vaccine. Second reason is because there are still some other emerging variants. We kind of found out with Delta variant that it is the real deal, and I'm sure it won't be the last variant of COVID that will kind of take hold. And sometimes, there might just be more contagious variants that do emerge and maybe aren't as covered as well with the vaccine and maybe impact kids more than previous variants have. So I think for a lot of different reasons, but kind of those main ones, that's the reason that we're still recommending full masking, which we very know is a controversial topic, but even if a kid has a vaccine, they should still wear a mask at school.
And I think going back to the data that Lori presented is that while we know that children and adults after vaccine can still have breakthrough cases, and there's discussion about how well is that immunity lasting even for the circulating strains. I also do want to emphasize to families that it's worth it. The chance of having serious enough illness to need to be hospitalized is significantly lower if you've had your vaccine. And we expect that that'll be the case for children too. And so continuing to wear a mask, but being able to be back in school. Oh my goodness, how wonderful that's been for our kids this year. It has been, I think are the messages that we need to really be talking about. You know, this is a positive that the kids are getting back to school and getting back to more normal activities, even if they have to wear their mask.
Awesome. Thank you, guys.
Howdy, I've got a question for Kallie. This is John with the Lookout, just based in Big Sky. Can you hear me? Just want to make sure.
Yep, I can hear you.
Awesome. Sorry, I haven't been around for a while, but just playing a little catch up here. Is it possible for me to get the % of employees who are vaccinated at Big Sky Medical Center? Is that data that you guys are able to share?
Yeah, let me have you reach out to Lauren Brendel, who's our
Okay.
Our director of communications, and have her work through getting that information for you. As you can imagine, there's a lot of hot topics right now surrounding employee vaccinations, and so she'll work with you to answer that question and to vet through that. So yeah, do you have Lauren's
Awesome.
email?
I do. I'll
Yeah,
follow up with Lauren
overall,
on that one.
yeah, overall at Deaconess Hospital, we've had roughly an 80% employee vaccine rate. So we're very proud of that. But as far as separating out different areas within the system, I don't know those numbers off the top of my head, but good question.
Yeah, and a follow-up question for you. Do you guys have any plans at the moment to offer the boosters at Big Sky Medical Center?
Yep, they're already being offered. We have typical vaccine clinic hours in Big Sky, which is Lori, you probably know better than I do. Is it Tuesdays at Big Sky? And so there's a particular day in Big Sky, I believe it's Tuesdays, but I'm going to confirm that with you, John. I'm going to have Lauren actually reach out to you and confirm the Big Sky dates. I know they're on our website, but I won't take the time to look it up right now, but they have particular open vaccine clinic days where individuals can sign up for or walk in. And then they also have the ability for anyone who is established as a patient to come into a typical appointment or to schedule a vaccine appointment at their convenience. And they are doing that through their normal family practice clinic as well.
Got it. And last question for you, Kallie. I know this is going to be a hard one, but we've got a few large businesses in Big Sky, like Lone Mountain Land Company, Big Sky Resort. So OSHA just obviously issued their January 4th deadline. Yep. They're also in this position where they're hemming and hawing over what to do with probably some of the legal repercussions. Do you have any take on that? What would you say to them? Some of these larger organizations that are struggling with this conflicting messaging from the federal and state government.
Gosh, I'm trying to think of what I would say as Kallie Kujawa, System Director of Quality and Safety, and what I would say as Kallie Kujawa as myself, having experienced many chapters of the pandemic. I'll give a quick answer and then I'll give a more official answer, but we've had many chapters within this pandemic and some have been extremely challenging, but we've succeeded through them all. And so I would say that although this may be another challenging chapter for us to overcome within the pandemic, I'm confident that we as a community, because of what we've demonstrated already, will absolutely find that path forward. Now, your question is, what does that path look like? And what would we say when we're in the thick of the difficult conversations? And I don't know yet. There's so much overlap and there's so many components to how House Bill 702 interacts with the regulation, and it's very unclear because it's not part of the Constitution, and it's not part of certain other types of laws. So it's getting very, very difficult and messy to navigate that. But the one thing that we've done as a health system just to prepare for this moment is to encourage anyone who's medically eligible to get vaccinated before whatever that exact mandate looks like in the end come January 4th. We've already worked through that, and we've gotten people who are eligible vaccinated. And one thing I would encourage individuals who are hesitant but are eligible is to really reach out to someone that they trust and to talk through it. Reach out to their primary care provider. We have very knowledgeable employee health professionals and individuals who are supporting employee health who will have those very difficult conversations and sometimes emotional conversations with individuals who have been hesitant to receive the vaccine. But just to really, encircle those people, support anyone who may be hesitant or fearful of receiving the vaccine, and give them as much reputable information as possible so that they can be making the best decision for themselves. But really encouraging people to sort through that now before we find out what we're going to have to say to individuals come the end of the year and the beginning of next year. So I don't know if that answered your question, John, but that's
no, it's a hard one.
A little bit.
It's a hard one. And just follow up here. This is actually, I'm going to send this Tracy's way at Montana State. I think I'm still figuring this out, but will the private sector impact you guys? I think I'm just playing catch up a little bit here. You guys are obviously also in this limbo phase at Montana State, but will this potentially impact y'all?
So John, the OSHA requirement, the legal counsel at the Montana Office of the Commissioner of Higher Education has determined that the OSHA requirement does not apply to the state employees who work for the university system.
Awesome. Thanks, Tracy. Just curious. Thanks for the clarification. That's all I have on my end. Thanks, y'all.
Thanks, John. I appreciate the question. Others out there? Other questions out there?
Well, Lori, I had just wanted to say that, it was really exciting to hear how successful the turnout was for Bozeman Health, and Billings Clinic is going to be starting our vaccines on Tuesday of next week, as we're calling our families and getting them organized to come over to our new facility, which is going up behind Costco off of Valley Center Drive. And so if families need that vaccine, please give our office a call and we can make arrangements to get them covered.
Great, thank you. I'm glad you mentioned that. And I just want to reiterate that there are a number of locations where individuals can receive, whether they're looking to receive their first, second, third, vaccine. There are a number of locations where individuals can go. And we do have a lot of them listed on the Healthy Gallatin website. You can also go to vaccine.gov, and we'll continue to push all of those locations because, again, it really, where you have a medical home or where you have a trusted individual that you have spoken to in the past, we know that that kind of connection really can make a difference. So we'll continue to share that information and those resources as best we can with the entire community so everyone knows where they can go to receive that vaccine. So thank you for mentioning that.
You're welcome.
Other questions out there today?
I have a question that is maybe getting into the weeds. But I'm wondering, when we talk about like the 63%, the overall percentage of people fully vaccinated, if adding the 5 to 11 age range is going to change how that number looks next week or in the coming weeks.
I'm so glad you asked that. And I meant to mention that earlier. Yes. So when we have additional individuals, added to the eligible population, our denominator is going to change. So we may see a small decrease in their percentage of fully vaccinated, but we should see a good catch up here as more individuals get vaccinated. So thank you for asking that. It's not too far into the weeds, so that was great. Thank you.
Yes, thank you.
All right, any other kind of closing comments from either of our pediatricians to share out with the community? I'll turn it over to you both.
I mean, I think we're all just super excited that we're finally able to get the vaccine down to 5. I'm really anticipating hopefully early next year that it'll go down to 6 months so I can finally get my kids vaccinated without faking their age, which I wouldn't do. But I think it's just a great time to kind of, include our patients in being able to be among the ones protected with the vaccine, because it is impacting kids a lot more than it has. And I think it just makes sense for them to also get into the vaccine eligible age groups.
And I would echo that. We're really excited to be able to offer it to our younger patients, and our littles are not on that list, unfortunately, under the age of 5, but at 5 to 11, we're ready to go. 12 and up, if they haven't been vaccinated already, we're ready to go in those groups too.
Great. Well, thank you so much. I appreciate the partnership and everyone joining us on our call today. Please, connect with us again next week. We will be back again with additional opportunities for more questions as they come. But we appreciate the time that each of you took today to be with us. And I hope you all have a good, safe, and healthy weekend. Take care.
Take care.